New videos every day.
Life, wisdom.
Hi, I'm Dr. Vincent Bellonzi, and I'm glad to join you today. I want to talk a little bit about affordable health care. There's a concept out there that we can set up equal access for everybody to health care, and if we spend enough money, if there's enough government intervention, that everybody's going to be taken care of. But this is a real problem for people to assume that they need someone to take care of them. Healthcare really is, I'll term it more disease care. Healthcare is managing diseases, and to some extent it tends to perpetuate disease. Chronic disease is at an all-time high, and it's still growing at epidemic proportions, whether you talk about diabetes or even things like cancer. Chronic disease is something that's manageable with lifestyle, yet people don't seem to pay attention to their lifestyle until they contract a disease. There's no way we're going to find enough money, enough government management to take care of everybody who's sick presently. And if the trends continue, then more and more people having chronic disease will never be able to keep up with it. The only real answer is to prevent disease in the first place. In fact, there was a recent research article in the New England Journal of Medicine, and they discussed the fact that we need to start discussing preventive measures instead of simply waiting for a disease to occur. Prevention so far in conventional medicine has been nothing more than find something early and then begin to treat it. When it is very possible, we know more than we ever knew before now about epigenetics and how you affect your genes. It was an assumption that if something was in your genetics, you were automatically going to experience it. But that's not true. We're finding that as we understand the interaction of environment with genetics, that you don't have to contract a disease and you don't have to live with it. So unless we start recognizing the importance of what we do in our lifestyle, what we choose to eat, how physically active we are, your body's only adapting to what you do day to day. And that adaptation can be good or bad. If you're not paying attention to things, very likely it's going to be something you don't want to deal with, like a chronic disease. So if we're going to find a way at all to manage all of the chronic disease cases, we're going to have to find a way to prevent them from happening in the first place. That's the only answer that I can see, because the numbers just don't add up. We continue to allow people to live a lifestyle that creates disease, and then we try to find a way to manage it. It's just not a possible scenario, no matter how much, again, we throw into it as far as money. Your lifestyle absolutely has the biggest impact of anything you're ever going to do, much better than any medication or drug that's out there. In fact, your choices in food actually communicate to the body function or dysfunction. And disease is nothing more than a dysfunction. If I'm choosing the right food choices that work along with my genetics, I don't end up creating the disease situation. So then I don't have to worry about affordable care. I don't need the care. And the same with my level of physical activity. If I'm not physically active, I'm going to be more sedentary. I'm allowing the biological systems in my body to just shut down. And that means dysfunction, that means disease. So it's not about blaming people. It's not about assigning guilt or anything like that. It's about making people aware of what they're doing by ignoring their health. And it is really just a fact of not paying attention and not doing things that are going to create a situation where you're not having disease. It is truly a choice that we make every day, every meal, every time that you decide that you're not going to be physically active. And even though it sounds very simple, those are the most impactful things you have. Let's take diabetes as a quick example. Most diabetics are considered a lifestyle disease. In other words, the diabetic lived a lifestyle that created a loss of control of blood sugar, which led to all of the problems that they're having. And then the answer medically is to give them some pills and eventually put them on insulin and eventually keep them in the hospital. That's one road to go down. The alternative is to not lose control of your blood sugar, which is a very doable situation, by eating foods that don't cause your blood sugar to go out of control, and by being physically active enough so you can control your blood sugar, because you can transport sugar just by physical activity. So if I gain the control over my blood sugar, I'm not a diabetic, I don't need the disease management, and we don't need to pay more for healthcare. I'd much rather spend the money on other things. because we don't have the money in the first place to cover all of this. And there's a lot of other important priorities that should be set instead of just trying to figure out how we're going to have more doctors and more hospitals and more drugs. We're already experiencing drug shortages. We don't have enough hospitals to take care of the people presently. And doctors, because of this equal access to health care, have figured out that they're not going to be able to make the same money and they're going to have to work harder. And a lot of doctors are leaving the field. So instead of increasing practitioners, we're actually losing them. How is all this going to work? How is all this going to fit together? The only real answer that I can see is prevention, and it's something that you can do. So this is Dr. Vincent Bellonzi. Learn how to prevent your disease. Don't just manage it. So if you want more information about what we've talked about today, then you can get a whole copy of my book, Health Recklessly Abandoned. I talk about a little more detail on how to get control of your health, how to take care of yourself, and the fact that people have, in a sense, abandoned their health and how they can get it back. You can order the book on my site, www.recklesshealth.com, or you can find it on Amazon or Barnes & Noble or any site like that. So if you liked the video, go ahead and like it on Facebook, get it on Twitter, subscribe to the site. There will be more videos. I'm going to get into more detail on certain aspects of health, and we're going to talk about physical and mental health. So again, if you want more information, you can get my book, Health Recklessly Abandoned. This is Dr. Vincent Bellonzi. Thanks for listening.